Hi, my name's Smythe. I'm a doctor of naturopathic medicine and a acupuncturist and Chinese medicine practitioner at Creekside Health in Whistler. It's not really a bridge so much as that it's all, each modality or each different therapy facilitates a different need within the health picture of a patient. So depending on what someone's coming in for, I am able to reach into my toolkit of, acupuncture and all of the other Chinese medicine tools that I have from that realm, as well as, all the tools that are in my toolkit for naturopathic medicine. And so one of the great things about all of that together is that I really truly believe that for any given health issue, it's not usually a one thing solves all kind of program. So one of the things that I really love is that each individual person and their health concerns usually speaks to something unique to them. And so what we're able to do together is decide, okay, what do you need? And I can reach into my toolkit for various things, from all of my studies to facilitate that, or, I refer them to what I think is best for them. Whether it be, chiropractic or osteopathy and, so on and so forth. I love the integrative program at Creekside Health and just an integrative program in general. I know what I'm good at and what I can facilitate with patients, but if I can't do that, then I refer out. So if someone were to book in a naturopathic initial with me, it's an appointment that's a little over an hour. And from that space, we talk about primary health concerns, really unpack all of those, and then go into a full comprehensive health history. And it's from there that we are able to connect the dots to really get to the root cause of what's going on. And that's something that I'm really passionate about is the root cause aspect, or it's part of the philosophy of naturopathic medicine, is approaching health from that standpoint. At the end of the appointment, that's when we come up with the game plan of either pursuing lab tests, so either basic blood labs, advanced testing, and then from a treatment approach, usually involves some sort of diet and lifestyle modification, supplementation, potentially pharmaceuticals if those are indicated, and then we platform out from there. Yeah, so when patients come in to see me for Chinese medicine for the first time, again, similar to naturopathic medicine, we talk about the primary concern. How I lens it out is a little bit different to sort of tailor it into the philosophy or the theory of Chinese medicine. So I'm thinking about certain channels. I get information from a number of different areas. So after my line of questioning, I usually take the pulse, where that gives me information for diagnosis or things that might need to be addressed for them, as well as I read their tongue. So I ask people to show me their tongue, and that also gives me another layer of info of what we can do for them. And then from there, the treatment is usually acupuncture. So insertion of needles into specific points based off of, particular diagnosis. And then I usually use cupping in some way, whether it's usually on the back. And so cupping, if you're not familiar, is traditionally a glass cup that you insert fire into, creates a negative pressure, applied to the skin, creates a suction. Cupping's amazing, really, really great at increasing circulation and releasing fascial adhesions from a Chinese medicine perspective, really helpful for moving qi. So qi is essentially energy, and when we're moving that, we're able to move through stagnation in the body. It can be amazing, both on a physical level, but also on an emotional level. I find that a lot of people feel really invigorated and revitalized after they've had moving cupping. I know I feel that way. And I've had, patients say that as well, but it's a really neat therapy because there's not many things that lift the tissue. Most other similar therapies such as massage, they compress the tissue. So this is a really cool method where we actually are able to lift the tissue and strip through things and increase circulation. It's an amazing tool. So in practice, I see a good deal of hormone imbalance in women. There's a number of women that come in to see me to seek out help with that. I see a lot of pain cases. So of course, being in the corridor, there's lots of injuries and things like that. So I work a lot with that, both with acupuncture and injection therapies primarily. I also work a lot with fatigue. That's another big thing in this town, whether it's from, sort of this type A driven style. This corridor tends to be pretty highly concentrated in type A personalities. And when you burn the candle at both ends, fatigue and burnout, it usually comes up at some point. So I deal a lot with that as well. Yeah, so for hormones, again, so let's say a woman, for example, so it's, I see a lot of women that have menstrual irregularities, or difficult menstruation, or just, issues in and around there, or perimenopause, menopause, things like that. So what we do through questioning, I'm able to get a sense of what's going on clinically. So when I say clinically, I just mean from symptomatically what's going on. Am I getting a sense that estrogen's driving high, progesterone's low, like I'm, things like that. And if necessary, we may pursue lab testing. So a lab that I really like to run, really commonly run, is a Dutch test. So it's a urine test to assess for all of the sex hormones, estrogen, progesterone, testosterone, as well as the cortisol rhythm or adrenal rhythm. So that's something that I run really, really often. It's an amazing test, gives us a lot of info to work with. May also run basic blood work. So commonly with women with hormone imbalances, we may also see potentially some thyroid irregularities, may also see low iron, another common thing that comes up. So all of that comes into the picture of what's going on for that person, and then we approach therapy appropriately from there. I love working with pain and pain management because I've experienced chronic pain in my life, and a number of people that I know have experienced chronic pain, and the effects that it can have on you, obviously physically, but psychologically. I think being able to work with that and to be able to help correct that is huge. And living in the corridor, in the Sea to Sky corridor, injuries are rampant. People have blown knees, blown shoulders, blown this, blown that. So to be able to offer therapies that help facilitate healing is huge and amazing, and I want to be able to offer something in that area. It's the gold standard of doing injections. So with ultrasound, what we're able to do is see exactly where we're going. We're able to see the structures that we're needling into. We're also able to assess the structures. So are there micro tears? Is there edema? Edema just being fluid accumulation, other signs of damage and inflammation in the tissue, where yes, we can gather some of that information through visualization and palpation, but with the ultrasound it just adds a whole other level of being able to assess structure. So with the ultrasound, what I do is use that as a guide to facilitate my needling. So I'm able to see the structure that we're assessing, or the damaged structure, and then I can see the needle going in, targeted to the area that we're looking to treat. So different types of injection therapies that I do are prolotherapy, neural therapy, and perineural therapy. So a little bit about those and what they do. Prolotherapy falls under the category of regenerative injections. So what prolotherapy does is it's a injection of a solution of dextrose at a particular concentration. It's at around 15%, generally speaking. It does tailor out, but let's just say 15%. And dextrose is a sugar molecule, interestingly. So some people might find that a little bit strange that we're injecting sugar, but the really neat thing is that it's this totally benign substance that we're able to inject into structure. And what it does at that concentration is it causes a very focused targeted, localized inflammatory response. So with that being said, I know inflammation has this negative connotation. It's something that we're always trying to manage. But the reality is that inflammation is actually a huge piece of our healing cascade. It's what brings in all the factors like fibroblasts and things like that come in and build tissue. So that is in essence what prolotherapy does, is it calls in our body's inflammatory response to rebuild structure. So the reason that that's important for both ligaments and tendons, which are commonly what we're treating with prolotherapy, is because those are two tissues that are commonly damaged in sports and overuse injuries, things like that. But the issue with those structures is that they have a really poor blood supply, and blood is what carries nutrition, waste removal, and all of that. So they tend to not heal well, and that's what leads to chronic pain and functional and structural breakdown and all of the things. And so that's where prolotherapy can come in and help treat those damaged tissues and restore the structure and function. So other two injection therapies that I utilize are neural and perineural, similar but different. So let's start with neural therapy. So neural therapy is a injection of a local anesthetic. So what I commonly use is Procaine. So Procaine's in the same family as lidocaine. Most people have had that at the dentist's office for tooth freezing. And how this works for pain management is by resetting the pain signal. So oftentimes we see in chronic pain is a signaling issue. So let's say with your knee or any given injury. So I injure my knee, sensory receptors in my knee signal to the brain there's an injury, my brain perceives the injury, and it cycles through tissue, brain, and it creates a circuit neurologically of signaling that there's pain in an area, or then an issue, and so on and so forth. And so what we're doing with the Procaine, oftentimes in chronic pain, there's a signaling issue. So our brains are plastic, or our neurology is plastic. And what I mean by that is that it changes. It's not this finite thing. So we're able to build pathways, but we also have to unbuild them. So sometimes we'll get caught in these dysfunctional patterns, and that is part of a chronic pain issue in most cases. And so what the neural therapy does is it goes in, and as a local anesthetic, it blocks the pain signaling. And so what we're able to do with this is we're able to give the nervous system an opportunity to identify that there's no longer an issue in a particular area. And so that's something that can be really, really helpful for chronic pain, is often something that we layer on with other things that we're doing. Similarly, but a different mechanism, is perineural. So perineural therapy is a solution of dextrose, also, so same substance in essence as prolotherapy, but it's at a very different concentration. So it's at a 5% concentration. And what dextrose does at a 5% concentration is it acts as a anti-inflammatory to neural tissue. So really great for neuropathies, also can be utilized in the same way as we use neural therapy, so for chronic pain and signaling and things like that. So these are some of the injection therapies that I utilize for pain management and helping to heal structure and function. Another thing that I do, so PRP is the long name for it is Platelet-Rich Plasma. So what we do with that, it's another regenerative injection therapy under the same umbrella as prolotherapy. Different mechanism, but what PRP does, what we do is we draw your blood, and then we spin the blood, extract the platelets, and then re-inject them at a particular concentration. And what that does is it's basically using your body to heal itself. So platelets are very, very healing, and they're able to go in and heal damaged tissue. So one of the things that inspired me to get into ultrasound guided injections is through a personal experience. Someone close to me was injured in a needle stick injury where a needle was stuck too deeply into the neck and it grazed their vertebral artery, and they ended up with a significant brain injury as a result. And to me, I want to be able to offer these therapies, but at their highest standard. So what ultrasound allows us to do is to take the guesswork out. We can see exactly where the needle's going and what structure it's going into. We're able to see where the blood vessels are and avoid those. So, it's one thing to be injecting the knee into, or the ankle, what have you. But when we start moving into the spine and other more sort of vulnerable areas, I think it's really important to be able to see exactly what you're doing. And so that was one of the things that inspired me to get into ultrasound guided injections.